Hello everyone, with you is Dr. Demchenko, and today we will go through the most effective exercises for shoulder joint pain. Let's go! The shoulder joint area is very complex. The thing is, there are three joints there. One joint is between the shoulder bone and the scapula. The second is between the scapula and the clavicle. And the third is a conditional, but very important joint between the scapula and the chest wall. And all these three joints must work very well and smoothly in order for the shoulder to move easily and without pain. Because of the complex structure of this area, there are many different diagnoses and problems that can lead to pain and limited movement. In this video, I tried to gather the most effective exercises that can cover a large part of these problems and significantly alleviate your feeling. If the pain in the shoulder developed as a result of a severe trauma, for example, you fell on your arm or sharply pulled your arm, after which there was, for example, some sound, crunch, creak, after which there was swelling in the shoulder area, severe pain, inflammation, then first I recommend you to see an orthopedic traumatologist, do a magnetic resonance imaging resolve the issue with severe inflammation, remove the swelling, and only then proceed to these exercises. Also, if you recently had surgery on your shoulder joint, it's better to start not with these exercises, but with the exercises in our video on rehabilitation after surgery on the shoulder joint. When will these exercises help the most? If your pain didn't start with any trauma and you just noticed that your shoulder started to hurt either after heavy loads or seemingly on its own, then these exercises will help the most. Before working with the joint, it is necessary to relax and massage the shoulder muscles. For this, you can use a tennis ball, a foam roller, or a percussion massager. So all these three joints should work in the so-called shoulder-elbow rhythm. That is, when moving the arm, we should have three coordinated movements in these joints. So, for example, let's consider lifting the arm. First, there is movement in the shoulder joint, that is, between the shoulder bone and the scapula. You can put your hand on your shoulder and feel that the scapula does not move. But when you reach about 90 degrees, you will feel that if you want to raise your hand higher, the scapula will start to move sideways and slide. At the very end of the movement, when you will already be bringing your hand to your head, you can feel how the tension increases right in this place. This is the place where the clavicle connects with the scapula. And for the end of the amplitude of the movement to occur comfortably, the scapula and clavicle must move relative to each other. This is the movement you can feel at the end of a straight arm lift. Here you can directly feel how the clavicle rotates upwards, giving way to the scapula. If we have impaired movement in one of these three joints, then we will feel pain in the amplitude of the movement. If it's the shoulder joint, then the pain will be somewhere up to 90 degrees. If the paddle doesn't move, then we're probably not going to be allowed to go higher. And the end of the movement will most likely stop in the acromioclavicular joint. So, in order for the shoulder blade rhythm to be correct and good, we first need to relax all the tense muscles that provide movement in these joints. Then carry out mobilization, that is, improve mobility in these joints. And third, pump weak muscles that do not allow the joint to move effectively. So the first part, myofascial release. First, we'll perform a myofascial release of the broadest muscle. To do this, place a foam roller under the area of the broadest muscle. And here you can do several pressure variations. If you pull both hands away, the pressure will be very strong. If the muscle is tightly clenched, it can be very painful. To start, I suggest keeping your hand on the support. Next, put weight on the roller and slowly roll over it, controlling your position with your legs. If you feel the pressure is too light, you can take your hand off. Then the pressure will become stronger. If you find any particularly tight spots, stay on them for 30 to 40 seconds until they relax. That is, you found it, pressed it, and held it. Next, we will perform a myofascial release of the sublingual, small and large round muscles. For this, place the roller in such a way that it falls on the blade. Roll slowly, looking for the most painful areas. You can also lift your hand slightly and swing it to better roll this area. You can also change the pressure on this area. For example, you can either leave your other hand for support or put more weight on your legs. If you want to increase the pressure, then on the contrary, reduce the number of support points. That is, lift your buttocks off the floor and then you will put much more pressure on your muscles. The next one will be the release of the trapezius muscle. For this, lean from the middle of the shoulder into the corner. Find the painful area. But try to keep your spine parallel to the floor and make small lateral movements of the neck. You should feel a good stretch in this area, then move the corner slightly to another place and repeat the lateral movements of the neck. You can also perform them passively with the other hand. It's very important to maintain pressure on the corner during head tilt. The next will be the release of the pectoral muscle. First, find the painful areas with your fingers. Place the ball in the painful area. Press it against the wall. And wait for relaxation. You can also make small movements by weight on the opening. Maintaining pressure on the ball, then move the ball to another painful point and repeat these actions quite often. You will feel a painful point in the middle of the scapula slightly below, about 2 fingers. This is also a very important zone. Place the ball here, press, and either just linger or make small movements for the opening of the body. For mobilization of the shoulder joint, place your hand on a stool, chest of drawers or shelf in such a way that the brush looks at the floor, and you stand with your back straight to this object. Next, we sit down for a good stretch of the shoulder joint. 2 main points. First, don't turn your body towards the stool. It will reduce the stretch in the joint. And the second point, you must reach the end of the amplitude. That is, sit down until you feel tightness and slight pain in the joint. Each time try to sit a little lower. Don't make jerks, make smooth, good stretching movements. About 15 to 20 repetitions. The second exercise is the mobilization of the ankle joint. Place both hands on the wall as high as you can. Your arms must be straight at the elbows. Then we make a lifting movement with the body. Which sort of slides the palms down when moving the body upwards. That is, the palms actually stay in place and the body moves, slides relative to the palms. From the side, it will look like this. Put your hands straight, straighten your back and dive. Dive as if you're pushing off from your back foot upwards. Move your palms down. Also repeat this action about 15 to 20 times. The most common mistake when performing this exercise is also bending the elbows and practically pushing off from the wall. This does not provide good mobility of the shoulder blade. The following is a technique for mobilizing the acromioclavicular joint. Ideally, you will need a long belt for this. You can make it by tying a few belts together, as I did. Now lay the belt in such a way that it lies on the distal, that is, the far end of the key. Here step on the other end of the belt with your foot and push it in such a way that the belt exerts enough high pressure on the key, about 10 kilograms, to increase or decrease the tension you can, slightly leaning away from the supporting leg. Try to raise your hand up. If you've done the mobilization correctly and it's necessary for you, then at the end of the amplitude of the hand lift, the pain should decrease and the hand should go further. Perform such a movement 10 to 15 times. For the last 5 repetitions, you can help go a little further with your other hand. If you don't have a belt, you can try to apply pressure with your other hand. Find the keyhole, press hard against the edge of the keyhole and lift your hand. The pain should lessen and the hand should go further. If this doesn't help, you can feel for the keyhole, place your hand on it and slightly push it towards the shoulder joint along the axis. While maintaining this position, also lift your hand. Quite often this brings significant relief. Also repeat 10 to 15 movements. Another useful mobilization can be stretching, that is traction of the shoulder joint with the help of a belt. Place the belt in the elbow bend and secure the arm with the other hand. Stand on the belt with your foot and apply gentle pressure with your foot down on the belt. At this moment, you can feel how the shoulder is stretching. If this exercise is very painful, it's better not to do it. If it gives a pleasant stretching pain, then this exercise is for you. You can make 10 to 15 foot movements and at the end, hold the stretch for 40 seconds. Relax your shoulder as much as possible so that the tissues stretch freely. At the end of the stretch, don't release the traction too quickly, that is, gradually over 2 to 3 seconds, reduce the pressure. This exercise is very beneficial for shoulder arthritis because it improves its nutrition, stretches the capsule, and improves blood flow. Very often, after stretching the joint, you may feel relaxation and warmth in the shoulder area. To perform the exercise, we will need a medium tension rubber expander. Next, position the expander in such a way that it passes through your hand. The brush was straightened, the elbow was straightened, and both the brush and the elbow were turned outwards, as if you want to stretch your shoulders well. The left hand goes behind the back and fixes on the chest. Like this. This is the starting position. From the starting position, we should lower the paddle to the center of the back and down like this, like this. What are the important nuances of performing this exercise? First, do not turn the whole body. That is, do not do like this. It's a short movement only with the paddle. The second moment, do not go high to the ear on the reverse movement. Don't do like this. That is, clearly to the neutral position and down, to the neutral position and down. The next mistake is often a jerk with the elbow. We don't work with the elbow. The elbow is always bent, the brush is constantly looking up, and only the wrist is working. If you perform the exercise correctly, the amplitude of the movement is very small, and you feel a good tension in the lower part of the blade. Do 15 repetitions, and at the end of 15 repetitions, hold the blade in the lower position for 40 seconds. You should feel how well the muscles in the lower part of the blade have engaged. If you don't feel enough engagement in this area, or it's too easy for you to do 15 repetitions, either pull the rubber harder or take a thicker expander. The second strengthening exercise for the shoulder will be the vertical dumbbell press. It's very important to perform it correctly and only if this exercise doesn't cause you pain. How are we going to perform it? Take a sufficiently heavy dumbbell, that is from 3 to 5 kilograms. Place it in front of you, the elbow slightly below the shoulder at the start. The dumbbell looks at you with the open side. Then we will raise the hand as close to the head as possible and at the same time rotate the dumbbell around the axis. At the end of the exercise, the dumbbell should be practically above the head and the fist turned to the opposite side. Then very slowly lower the dumbbell with the same reverse rotation. Try to pay attention to two very important things. The first rotation of the dumbbell axis does not occur at the beginning or at the end of the movement. It's as if it's fully smeared across the entire amplitude. So, the second most important thing in performing this exercise is that you can't bend your arm or body during execution. That is, incorrect execution will be like this. Such execution of the exercise, or such execution of the exercise, that is, the body and head must be absolutely level. The hand should pass as close as possible to the head, as close as possible to the ear, and descend exactly along the same trajectory. Plus, this exercise is such that it does not put harmful stress on the shoulder and allows all the muscles of the shoulder joint to be engaged in one exercise. Repeat it for about 5 to 7 lifts, but very slowly with good technique execution. If you feel that this is too easy for you, it's better to increase the weight of the dumbbell rather than increasing the number. Repetitions. If you feel that your technique is breaking down, then either do fewer repetitions or lighter weight. The next strength exercise is a static load on the biceps of the arm. To perform it, take a heavy dumbbell and make a blunt angle in the elbow joint, about 135 degrees. Then maintain the static tension for 2 sets of 30 seconds each. This exercise can also be done without a dumbbell. You can, for example, approach a heavy writing desk, grab the edge, press your elbows slightly into the body and try to lift the desk. While doing this, also maintain the tension for 30 seconds, repeat twice. It's very important that these exercises are not performed during an acute period of shoulder inflammation. If you have relative integrity of the structures, that is, if you have muscle tears, ligament tears, or you have just had surgery, then you need other exercises. If it's painful for you to perform these exercises, or you feel a worsening of sensations after them, you can exclude specifically those exercises from the complex that are not suitable for you. Do these exercises twice a day for a week and a half to 2 weeks, and most of the standard problems in the shoulder joint area should decrease. Subscribe to the channel, give likes, it really motivates me to make new videos, and see you soon.